You may think that bathing late at night is harmless, even relaxing after a long day. But the truth is that this habit can quietly put your heart and brain in danger. Sudden changes in body temperature at night can raise blood pressure, strain the heart, and even trigger a fatal stroke while you sleep. I have seen patients who believed a quick shower before bed was safe, yet they collapsed from dizziness, heart stress, or neurological shock. In this video, I will reveal 5 hidden dangers of nighttime bathing and safer habits you must follow to protect your health. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. And if not, type 0, so I know how to make better content for you. Part 1. Why late night bathing disrupts sleep and weakens the body's natural rhythm. The first danger that many people underestimate is how bathing late at night interferes with the body's natural rhythm of rest. Normally, as bedtime approaches, your body prepares for sleep by gradually lowering its temperature, slowing the heart rate, and releasing hormones that signal relaxation. This cooling process is essential for deep and restorative sleep. But when you take a bath too late, especially with water that is very hot or very cold, you disrupt this delicate balance. Hot water raises your core temperature, delaying the natural cooling process, which in turn makes it harder to fall asleep. You may toss and turn, feeling restless or unable to drift into deep sleep. Cold water, on the other hand, shocks the body, causing the nervous system to release stress hormones that keep you alert rather than relaxed. Seniors are especially vulnerable because their circadian rhythm is already more fragile with age. Even small changes in body temperature can create bigger disturbances in sleep quality. Over time, poor sleep weakens the immune system, raises blood pressure, and increases the risk of cardiovascular disease. Many patients who regularly bathe late at night report difficulty sleeping, frequent awakenings, or feelings of fatigue the next day. They may not connect these problems to their bathing habits, but the link is very real. Scientific studies confirm that body temperature plays a critical role in initiating and maintaining sleep. When the natural cooling cycle is interrupted, brain activity remains more alert, and the depth of sleep is reduced. This means that even if you spend 8 hours in bed, the quality of rest is poor, leaving your brain and heart more vulnerable. Poor sleep also increases stress on the blood vessels, raises cortisol levels, and weakens glucose control, all of which contribute to long-term risks such as stroke or heart disease. Imagine trying to rest in a noisy environment, unable to reach calm. That is what happens inside your body when you shock it with late-night bathing. The nervous system remains on guard, circulation fluctuates, and the healing process of sleep is disturbed. Over months and years, this creates a foundation of stress that quietly damages your health. The lesson here is clear. Sleep is medicine, and any habit that disrupts it must be taken seriously. Bathing late at night is not just a matter of timing. It is a matter of physiology. If this first danger has surprised you, wait until you hear about the next part, where I will explain how late-night bathing raises blood pressure, puts stress on the heart, and creates a hidden risk of cardiovascular strain that no senior should ignore. Part 2. How bathing late raises blood pressure and strains the heart. The second danger that must be taken seriously is how bathing late at night raises blood pressure and puts unnecessary strain on the heart. When you immerse your body in water that is either too hot or too cold, your circulatory system is forced to react abruptly. Hot water dilates the blood vessels, raising the heart rate and causing blood to rush to the skin in an effort to release heat. This sudden shift places stress on the heart, especially in seniors with weakened vessels or pre-existing cardiovascular disease. Cold water has the opposite effect, forcing the blood vessels to constrict rapidly. This vasoconstriction increases peripheral resistance, which means the heart must pump harder against tighter vessels. The immediate result is a spike in blood pressure and a racing heart rate. For younger people with healthy circulation, the body can usually tolerate these fluctuations. But for older adults with hypertension, atherosclerosis, or coronary artery disease, these changes can trigger arrhythmias, angina, or even cardiac arrest. Imagine a heart that has been working steadily at a calm nighttime rhythm, suddenly being forced to sprint. The shock is tremendous and dangerous. Medical studies confirm that sudden exposure to extreme water temperatures is linked to higher incidence of nighttime cardiovascular events. Bathing late also coincides with the body's natural drop in blood pressure during rest. This creates a conflict where the body is trying to relax, but the sudden thermal stress forces it into crisis mode. Patients sometimes describe feeling dizzy, experiencing palpitations, or having chest discomfort after late-night baths, but dismiss these symptoms as minor. In reality, these are red flags that the heart is being overworked at the very time it should be recovering. The danger does not end with the bath itself. After stepping out of hot water, body temperature can drop quickly in a cool environment, causing further constriction of blood vessels and another spike in pressure. These rapid swings in circulation increase the risk of clot formation or vessel rupture, both of which can lead directly to stroke or heart attack. Seniors who already take medications for blood pressure or heart disease are particularly vulnerable, as their cardiovascular system has less flexibility to adapt to stress. The lesson is clear. Late-night bathing forces your heart into a struggle it was never meant to fight during hours of rest. Over time, repeated stress damages the vessels, weakens the heart muscle, and increases the likelihood of a catastrophic event. If this warning has caught your attention, wait until you hear about the next part, where I will explain how cold exposure and vessel constriction during late-night bathing directly increase the risk of stroke, the most devastating outcome of all. Part 3. The connection between cold exposure, vessel constriction, and stroke. The third danger you must never underestimate is the direct connection between cold exposure during late-night bathing, blood vessel constriction, and the risk of stroke. When you step into cold water at night, your body is forced into a sudden state of shock. The skin temperature drops quickly, and the nervous system responds with an immediate surge of catecholamines, the stress hormones that tighten blood vessels and accelerate heart rate. This is known as a cold shock response. While it may feel refreshing for a moment, the reality is that the blood vessels throughout the body, including those supplying the brain, are constricting rapidly. This sudden narrowing increases blood pressure and reduces blood flow to critical organs. For the brain, reduced circulation can lead to dizziness, blurred vision, or fainting. In severe cases, it can trigger ischemic stroke, where part of the brain is deprived of oxygen. For the heart, constricted vessels and elevated pressure can cause arrhythmias or coronary spasms that may result in cardiac arrest. Seniors are especially vulnerable because their vessels are less elastic, more likely to be stiffened by atherosclerosis, and already strained by hypertension. What a younger person may tolerate as discomfort can become life-threatening for an older adult. Scientific studies support this connection. Researchers have documented that hospital admissions for stroke increase significantly during colder seasons, with a drop of just 5 degrees Celsius leading to a 7% rise in cases. This demonstrates how sensitive the vascular system is to temperature changes. Late night, bathing in cold conditions magnifies this risk, as the body is already in a state of rest, with lower protective responses. Another danger is the mismatch between body and water temperature. When the body is warm indoors and suddenly exposed to cold water, the abrupt thermal contrast amplifies vasoconstriction, making blood pressure spike even higher. Patients with a history of migraines, vascular headaches, or angina often report worsening symptoms after such exposure. Another clue that cerebral and coronary vessels are under strain. Some people may also experience what seems like harmless dizziness or weakness after a cold bath at night. But these are early signs of disrupted cerebral blood flow. Ignoring them could mean overlooking the very warning signals of an impending stroke. The risk extends beyond the bath itself. Once the vessels constrict, the effects can persist for hours into the night, raising the chance of a clot forming and traveling to the brain while you sleep. This is why many sudden strokes occur in the early hours of the morning after late-night cold exposure. The conclusion is simple but serious. Cold water at night is not refreshing. It is risky. For seniors and those with cardiovascular disease, it is a potential trigger for life-threatening events. If this has startled you, wait until you hear about the next part, where I will show how late-night bathing also damages the brain and nerves, leading to headaches, dizziness, and even facial paralysis that should never be ignored. Part 4. Dangers for the brain and nerves, headaches, facial paralysis, dizziness. The fourth danger that many people overlook when bathing late at night is the serious impact on the brain and nerves. When the body is suddenly exposed to cold water or extreme shifts in temperature close to bedtime, the nervous system reacts abruptly. This sudden shock can disrupt blood circulation to the brain and lead to a chain of neurological problems. One of the most common complaints is persistent headache. Many patients who frequently bathe at night report waking up with pain in the head or neck, often attributing it to stress or fatigue. In reality, the sudden constriction of blood vessels during cold exposure can trigger vascular headaches, similar in nature to migraines. Over time, this repeated stress weakens blood vessels and increases the risk of long-term neurological damage. Another risk that must not be ignored is facial paralysis. Going to bed with wet hair after bathing late at night exposes the scalp and facial nerves to cold for extended hours. This cooling of the nerves beneath the skin can cause inflammation, leading to a condition sometimes called frozen facial nerves. The result may be weakness or paralysis on one side of the face, drooping eyelids, or difficulty speaking clearly. For seniors who already have reduced circulation and fragile nerves, the chance of developing this complication is far higher. Dizziness is another red flag. Many people describe feeling lightheaded or unsteady immediately after leaving the shower late at night. This is not simply harmless fatigue. The combination of sudden temperature change, altered blood pressure, and restricted blood flow to the brain creates a dangerous environment where fainting can easily occur. A fall in the bathroom at night not only causes trauma but may also mask an underlying neurological crisis. Cases of people losing consciousness in the shower and suffering fatal complications are well documented in medical literature. What makes these dangers even more severe is the timing. At night, the body's resistance is naturally lower. The immune system is winding down, and the nervous system is preparing for rest. When shocked at this vulnerable time, recovery is harder, and the damage is greater. Seniors with pre-existing conditions such as hypertension, diabetes, or vascular disease are especially at risk. But even younger individuals can develop chronic headaches, nerve inflammation, or fatigue when repeatedly exposed to cold stress late at night. Prevention is possible. Avoid bathing right before bed, especially with cold water. Always dry hair thoroughly and keep the head, neck, and shoulders warm after bathing. If you notice frequent headaches, dizziness, or facial numbness after nighttime baths, consider them warnings from your nervous system, not trivial inconveniences. The truth is that what feels like a simple habit can quietly damage your brain and nerves over time. If this has opened your eyes, wait until you hear about the next part, where I will explain why seniors with hypertension or cardiovascular disease face even greater danger from late-night bathing. Part 5. Added risks for seniors with hypertension or cardiovascular disease. The fifth danger you must never ignore is how late-night bathing magnifies risks for seniors who already live with hypertension or cardiovascular disease. These conditions are common in older adults, and while many manage them with medication, the fragile balance of circulation can be easily disrupted by sudden changes in temperature. When a person with high blood pressure steps into hot water late at night, blood vessels dilate, the heart races, and circulation is forced into overdrive. For someone with healthy arteries, this may be tolerable. But in seniors with hardened vessels or plaque buildup, this can lead to unstable blood flow and even plaque rupture, which is a direct trigger for heart attack or stroke. Cold water is equally dangerous. The abrupt constriction of blood vessels during a cold shower dramatically raises blood pressure. For an older adult with hypertension, this spike can exceed safe levels, putting intense strain on the heart and risking vessel rupture in the brain. Hemorrhagic strokes, where blood vessels burst and bleed into the brain tissue, often occur in these circumstances at night, when the body is preparing for rest. This shock is even more dangerous, as the natural protective responses are weaker. Seniors with heart failure also face unique dangers. Their hearts already struggle to pump efficiently, and late-night bathing adds further stress. The shift of blood to the skin during a hot bath can leave the heart deprived, worsening shortness of breath and leading to sudden cardiac arrest. Medical studies have shown that nighttime is already a peak period for heart-related deaths, and habits that intensify cardiovascular strain at this time increase the likelihood of tragedy. Many families describe elderly loved ones who felt dizzy, weak, or breathless after bathing late at night, only to collapse within hours or even die in their sleep. These are not coincidences, but clear evidence that the cardiovascular system was overwhelmed. Another overlooked factor is medication timing. Seniors who take blood pressure, drugs, or diuretics in the evening may already experience lowered pressure or fluid shifts at night. Adding the stress of hot or cold bathing further destabilizes their circulation, leading to fainting, arrhythmias, or dangerous blood pressure swings. The conclusion is simple. For older adults with hypertension, coronary artery disease, or heart failure, bathing late at night is not a harmless routine, but a risky trigger that can push the heart and vessels past their limits. Prevention requires respecting the body's limitations. Seniors should bathe earlier in the evening, use lukewarm water, and avoid long exposure. Families and caregivers should watch for red flags like dizziness, chest tightness, or unusual fatigue after baths. And seek medical advice when these occur. Remember, the cardiovascular system of an older adult is not as flexible as it once was. Protecting it means avoiding unnecessary stress, especially during the vulnerable hours of night. If this warning has struck you, wait until you hear about the next part, where I will share safer bathing habits that can protect your heart, brain, and lungs while still allowing you to feel refreshed and clean. Part 6. Safer bathing habits. Right time, right temperature, right method. The sixth and most practical lesson is that you can protect yourself from the dangers of late-night bathing by following safer habits built on medical science. The first rule is to choose the right time. Bathing should ideally be done in the early evening, at least 1 to 2 hours before bedtime. This gives the body enough time to stabilize its temperature and circulation, reducing the risk of blood pressure swings or nighttime cardiovascular stress. Bathing right before sleep forces your body into a sudden state of alertness when it should be winding down. So, avoiding this mistake can greatly improve both safety and sleep quality. The second rule is to pay attention to water temperature. Lukewarm water is the safest choice, usually between 36 and 38 degrees Celsius. Water that is too hot dilates blood vessels, raises heart rate, and causes excessive sweating, which can leave you feeling weak and dehydrated. Water that is too cold shocks the system, triggers vessel constriction, and raises blood pressure. Particularly dangerous for seniors with hypertension. Keeping water comfortably warm allows the body to cleanse and relax without causing circulatory strain. The third rule is to limit bathing duration. Long exposure, even in safe water, places unnecessary stress on the heart and lungs. Seniors should aim for showers lasting 10 to 15 minutes rather than extended soaks. Staying too long in hot water increases the risk of dizziness or fainting when standing up, while long cold baths may trigger chills and immune suppression. The fourth rule is to protect the head, neck, and shoulders. Always dry hair thoroughly and avoid sleeping with wet hair, which exposes facial nerves and the scalp to prolonged cold. This simple precaution helps prevent chronic headaches, nerve inflammation, or even facial paralysis. Wearing a towel around the neck or using a hairdryer for a few minutes can reduce these risks dramatically. The fifth rule is to listen to your body's signals. If you feel dizzy, short of breath, or unusually tired after bathing, treat these as warning signs, not normal reactions. Sit down, rest, and inform a family member if symptoms persist. Seek medical advice because they may signal hidden cardiovascular or neurological stress. The sixth rule is to prepare the environment. Make sure the bathroom is warm in cold weather to reduce the shock of temperature difference. Install non-slip mats and keep the floor dry to prevent falls, especially if dizziness occurs. Good ventilation prevents humidity from triggering breathing difficulties or worsening lung conditions. The seventh and final rule is to adapt bathing habits to your personal health status. Seniors with hypertension, diabetes, or lung disease should consult their doctor about the safest practices. Some may benefit from shorter showers, others from additional support like a shower chair. What matters most is that bathing cleanses and refreshes without becoming a source of danger. By following these habits, you can enjoy the comfort of bathing while protecting your heart, brain, and lungs. If this guidance has reassured you, stay with me for the conclusion, where I will summarize the key lessons and remind you why it is never too late to change habits and protect your life. Conclusion. We have now walked together through the hidden dangers of bathing late at night and the safer habits you can adopt to protect yourself. You have learned that this common routine, which many people assume is harmless or even relaxing, can in fact disrupt the body's natural rhythm, raise blood pressure, and strain the heart. You have also seen how sudden cold exposure constricts blood vessels, setting the stage for stroke, while late-night bathing leaves the brain and nerves vulnerable to headaches, dizziness, and even facial paralysis. For seniors already living with hypertension or cardiovascular disease, the risks multiply, making what seems like a simple habit a potential trigger for catastrophic events. Yet the lesson is not only about danger but also about hope. By choosing to bathe at the right time, with the right temperature, and in the right way, you can still enjoy the comfort of a clean and refreshed body without risking your health. Prevention is always within your reach. A warm shower earlier in the evening, drying your hair thoroughly, and avoiding extreme water temperatures are small steps that carry enormous benefits. Each safe choice you make reduces the strain on your heart, improves your sleep, and gives your body the chance to heal during the night. Remember, your body still remembers how to heal. Even after years of strain, your heart longs to beat steadily. Your brain longs to stay sharp, and your circulation longs to flow freely. But they need you to respect the limits and avoid unnecessary risks. Share this knowledge with your family, because what protects you may also protect your spouse, your parents, or your friends. Too many tragedies happen because people never knew the risks of something as simple as bathing at night. Awareness and action can prevent that. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned and plan to apply in your own life. Let us support each other on this journey toward safer habits and healthier nights. If you enjoyed this video, comment 1. If not, comment 0 so I know how to improve. Do not forget to like, share, and subscribe so you never miss another health tip made just for you. The choice is always in your hands. Turn bathing from a hidden risk into a safe and healing practice. Protect your heart, protect your brain, and protect your life. Starting tonight.